What is most unique, of course, about the grants from the federal office is that they are distinctly rural, whereas other grants can be either rural, urban, or even suburban. The grants through the community-based division are absolutely essential to the work that all of us do.
There were a lot of needs in rural communities that weren't being met by either kind of statewide and or federal efforts. And so this really provided that opportunity for local support.
Before I applied for the grant, the problem that we were trying to address was that we referred all of our clients to dental services. And then we would give them a phone number or a website, and then they would leave our doors and then come back 3 months later to find that they still never received care or never scheduled an appointment. So we knew the need was there. With our partnership with the oral health program, it really helped us to understand and learn more about our partners and all the services many more services that our clients could actually benefit from too.
The grants have really allowed our groups and the organizations, the healthcare facilities and the community-based groups to not only focus on the populations that they want to serve and the issue that they want to address. What they are doing is not only looking at bringing in the providers and bringing in the services, but it is very much a perspective of wanting to make sure that the clients and the patients who are being served are getting the kinds of education and outreach and connection that they need. The flexibility of the grants is quite helpful. We are seeing that there is much more of a focus on social determinants of health, looking at community health, looking at population health, and doing it from a connected vision of bringing together organizations within a rural county or a rural community.
What that has really opened up is an opportunity to form partnerships on a stronger level that are focused on specific goals.
The population of patients that we're currently serving in our area are usually underserved, rural, very rural areas with an elderly population that has difficulty with getting to and from their appointments and coordinating their care. These grant opportunities have given us an opportunity to reach out to those areas and really help those patients take care of their healthcare needs. We're seeing a drastic difference between the patients that are not enrolled in that chronic care program versus the ones that are.
There's so much need out in rural. There's no way one organization could possibly begin to tackle all of the issues and all of the problems. And it's not a competition thing. It's really a collaboration thing where we're all working together to really improve rural health across the state and across the nation.
There's a need everywhere, from front desk folks to radiology techs and laboratory. We received a HRSA Delta workforce grant. We have close to 40 enrolled in our program already in getting degrees anywhere from an associate's degree to a billing and coding degree to even a master's in business administration. And we provided scholarships for our current healthcare staff members so they could go back to school. We really want our employees to be able to move up, and into the careers.
We realized as electronic health records became prevalent, people were kind of getting lost in what I call the black hole of the EHR. A referral was made, and then there were gaps in care. HRSA was offering grant funding for quality improvement initiatives. So the funding we received for the project was invaluable. I mean, we really can't express how awesome it was to be able to access those funds. And so to be able to have the funds to support salaries for the staff that are dedicated to just one program is invaluable. The referral department is an example of that.
So what I have seen in the state through the implementation of these grants is capacity building. We've seen that through the network development planning grants, that partners that might have worked together in the past were able to come together and do some very solid planning and come out with a memorandum of understanding or agreement at the end.
We knew that we had an opportunity to help our healthcare community really focus on concentrating on the diseases that were prevalent in our area. So we're teaching our students how to manage databases, how to use health information business data to make business decisions in healthcare. So in hospitals and in clinics, let's just say that they might want to add on an MRI unit. Well, how do you justify that? So the analyst is actually looking for they're looking at the data and the story that the data tells, and it will demonstrate whether the need is there or not.
The Sun Smiles program is addressing intergenerational continuity of oral health care, meaning that the mothers that come in or the caregivers that come in, we are referring them and their children. We integrated community health workers into our WIC clinics in the Sun counties. They contact the client and they ask further questions about their oral health and any other need that they may have. That may include housing, transportation, utility assistance, childcare.
We've had a really wide variety of things that have formed in our states, from networks being set up and established, where I don't think, there was a framework for those folks to come together in the past, that really this offered them some funding and support to be able to come together to, really address what local needs are in those communities.
My role in the grant was making sure the acute care hospitals are aware that those services are out in the community, really talking to them about putting the swing bed program on, quote, the menu. Oftentimes in our rural communities, you have people who, they're going to have surgery 2, 3, maybe 4 hours away from home. And if they do not have to be, placed somewhere else, it allows them to get back closer to home. It allows them to be in a community where maybe their spouse or their children or their grandchildren are only about, 15, 30 minutes away versus that 2 to 4 hour drive.
We do have a few counseling services, but they may not have the funds. And not all counseling services take Medicaid. And so that's why this grant has been very good in coming, because these kids can be seen free of charge because it's paid through the grant. If we didn't have grant funding that we could offer this counseling services at school free of charge, these children wouldn't get services.
I'm hoping that through this, we're able to shed light on the importance of just being able to talk about your emotions and then working through our kids, and then hopefully they're going home and they're also teaching their parents or their grandparents that it's okay to show our feelings, because that will provide a brighter future for everybody.
There are a lot of needs, and through grant funds, we're able to meet many of those needs. When the grants run out, we'll do something. We'll figure out something.
The Federal Office of Rural Health Policy has people that are really paying attention to the needs and are really responding with funding opportunities that address those needs.